This segment of Delmarva Life is brought to you by Delmarva Dental Services.
It was 2010. Actor Michael Douglas announced that he was battling throat cancer. He later admitted that his cancer was actually an oral cancer of the tongue, one that was caused by the human papillomavirus.
And although the actor's prognosis is good, the number of people getting an oral cancer diagnosis is on the rise. So how do you know if you're at risk for this growing cancer? Knowing for sure may begin with a visit to the dentist.
When Dr. Jospeh Harmon does a dental exam, he's looking for more than just cavities and gum disease. He's looking for signs of oral cancer, something traditionally seen in older patients.
Typically, the oral cancer person was a male over 50 who smoked and drank. And we saw, and 75% of all oral cancers were that person.
But Dr. Harmon says that's no longer the case.
Now we're beginning to see people in their 20s and 30s with oral cancer, but a different type of oral cancer. The oral cancer with the smoking and drinking is called a squamous cell cancer, which is similar to typical skin cancer, not the melanoma, but the typical skin cancer.
Dr. Harmon says the cancer seen in younger patients is a different kind of cancer, one that is caused by a virus.
The HPV, or human papillomavirus, is a wart virus. It's really the same virus that causes cervical cancer. It's a sexually transmitted disease.
According to the CDC, there are 150 human papillomavirus. Out of those, 40 of them are sexually transmitted.
There's only 9 of them that really can cause oral cancer. And of those 9, most of them are caused by about 2 of the human papillomaviruses.
Dr. Harmon says this year alone, it's estimated that 40,000 Americans will be diagnosed with oral or throat cancer. In 5 years, 43% of them will be dead. That's why early detection is key. That's why Dr. Harmon says he's thorough when examining a patient. He's looking for warts or lesions.
You see them in the mouth, on the tongue, on the roof of the mouth. And now most people, their immune system takes care of it, and so it's a less aggressive cancer than the squamous cell where the drinker and the smoker, so it's an more easily treatable cancer. But the thing about the papillomavirus is not everybody gets a wart. So you could have the papillomavirus and not know it, and you can transmit the papillomavirus and not know it.
Dr. Harmon says preventing oral cancer caused by HPV is the same as preventing cervical cancer in women.
I think awareness of how easy it's transmitted and it's the potential for having a whole lot of cancers in the next 20 and 30 years, a massive amount of cancers, and what we're trying to do is let people know that there's risks for their sexual behaviors.
Dr. Harmon also recommends vaccines for girls and boys starting at a young age.
They're recommending that 11-year-old boys and girls get vaccinated before they become sexually active.
The good news is Dr. Harmon says once detected, oral cancer is treatable.
There's a biopsy that is very similar to the pap smear, where it's called a brush biopsy, which has been around about 10 years, which is great because it's not an invasive biopsy.
If the biopsy comes back positive, the cancer is removed, giving patients a survival rate of 85 to 95% over 5 years.
And Dr. Harmon says a Johns Hopkins study found a link between marijuana smoking and oral cancer. It is theorized that marijuana lowers the immune system and makes you more susceptible to oral cancer from HPV. And if you would like to read more about Delmarva Dental Services, go to WBOC.com, click on our picture at the top of the page.